Yay Networks.
Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and boy, do we have a show for you. It's your famous favorite Q&A, question and answers. That's right, we've accumulated a bunch of questions that you guys have sent in through social media and other platforms. I'm here with my favorite producer, Maria. Hola.
Hi.
And we're going to just fire them away. So we've eliminated some of the... Anyways, we've got all the good questions for you. So hopefully you'll enjoy this segment, and maybe you pay attention. One of your questions will be answered. All right, Maria, so let's dive in together. Are we dividing this to face and body? What are we dividing this into?
We have the face, and then we can go into the body.
Okay. All right. So let's first segment, it'll be facial questions. And the second half of the segment will be body. Go ahead, fire away.
Okay, from Ideal 77, she asked.
Ideal 77, fire away.
Okay, they ask, what makes someone not a candidate for a facelift?
So what makes someone a candidate? What makes someone not a candidate for a facelift? Okay, got you. So candidacy for a surgery is, in my opinion, is if I do the surgery, will I have a good outcome? The fact of the matter is, as a surgeon, I can operate on anyone. I could do a facelift on a 14-year-old if I want. Mm-hmm. It doesn't mean it'll look good. It doesn't mean that it needs to be done, but I sure as hell can do it. So that's the problem that we have right now is surgeons are capable of operating on people and are operating on people they ought not. So the question is, am I a candidate? The candidate means, will I have a good outcome? So there are two reasons why you should not do a facelift. One is you don't need it, AKA you're too young. So I'll have people coming in at like, I don't know, 39. And they'll have just the tiniest amount of laxity or little loose skin, just tiny amount early on. And they want to have a facelift. And now don't get me wrong, we're doing mini facelifts earlier and earlier, but there's no way you're a candidate for a facelift. That's insane. That's like using a cannon to kill a cockroach. That's just not the right thing. So that's one, meaning you're too early. And the other is you've had too many. Like I have people that come in, they're much older. They've had 2 or 3 facelifts. Their skin is pretty frail. Their skin is pretty pulled. And just by the sheer fact the quality of their skin is not that great, right? You're 78, 82. The skin is not as tight, but it's tight. I don't know how to explain it. I mean, there's no skin to remove, but the quality of the skin is not so good. The answer is not another facelift. The answer is nothing. Now you're going to have to age gracefully. I mean, there's nothing left to do. So those are the two instances, in my opinion, that you're not a good candidate. Obviously, there's like, oh, you have health conditions and all those other things, or you can't afford it, or blah, blah, blah. That's not relevant. Surgically, those are the two instances that I wouldn't operate on.
And is there a limit of how many times you can do a facelift?
I mean, not really. You'd say that there would be, but the truth of the matter is, as you have loose skin, you can remove it. So but most people at the most, they'll get 2 facelifts in their lifetime, right? You get a facelift in your 50s, you get a facelift in your 70s, you get a facelift in your 60s, you get a facelift in your 80s. You're not going to get a facelift in your 40s, then 50s and 60s, and it's just not going to happen.
Okay, so the next question comes from sin.al.
Sin, what? What's the name?
CIN.ALV.ULD.
Wow. Okay, guys, try to make easy names here so that we can give you a shout out. I don't even know what that was, but go ahead. What's the question?
Okay. This one is regarding chin implants. Are they custom made or do you choose from pre-made options? That's a good question.
Great question. So chin implants, as anyone who follows this podcast knows, I love chin implants. I teach the course. I do probably more chin implants than most people in the local area. And the reason why I love it is because it's literally, in the right candidate, the most powerful thing you can do. Like, no question, no hands down, you can take someone that's like barely noticeable to be like, wow, he's pretty handsome. Oh, wow, she's attractive. Because no one, doesn't matter if you have Asian eyelids or African-American lip, no one looks good with a weak chin or a weak jaw. Nobody. It just doesn't happen. So the question was, are they just pre-made or are they customized? And the answer is both. The overwhelming majority of chin implants that I do, there are different shapes, and in each shape, there's a different sizes. So for example, one of them is called MPJC, Middleman Pre-Jowl Chin Implant. Let's just call it Chin Implant X. Well, Chin Implant X comes in extra small, small, medium, large, and extra large. So within that style, there are various sizes. And then there's another implant that I use. It's called EAC, Extended Anatomical Chin Implant. So let's call that implant Y. Again, extra small, small, medium, large, and extra large. So right there, those are prefab, meaning they're pre-made, but they're customizable in that you pick the shape that you like and the size that you need. And then within that, I can customize it further because these are solid blocks of silicone. So in some instances, I will then carve or remove a little bit of the implant in areas that I don't want. So for example, a common thing is I need the projection. Everyone who wants a chin implant wants projection, forward movement of their chin. Some people don't want their jaw to get wider. Well, tough shit. As it goes forward, it gets wider. That's just how these chin implants work. So sometimes I'll shave a little bit of the width off so that you get more projection than width. Lastly, there are individuals, I'm not one of them, who do full customized chin implants and full customized facial implants. And that means that you go in, you see them, they do a CAT scan of your face, and then they build you whatever implant fits exactly on your bone and order it from the company, and they make a moulage or like a mold. Wow, that sounds amazing. Let's do that. It's not necessary in 95% of times because it's very expensive, very complicated. And the truth of the matter is that I don't know that you can tell or discern the differences. So those are the ways in which chin implants are customizable.
And do these chin, can they stay there forever, or you'd have to revisit and
Yeah, so chin implants are unique in that they're forever devices. So unlike a breast implant that ought to be replaced every 15 years because it's soft and it can break, chin implant is just a solid implant. So it can and often does last a lifetime. The unique element about chin implants, if you hate it, you can take it out. You really can't do that with other implants. The skin has stretched out too much. It doesn't look right, et cetera, et cetera. So they're very remarkable implants.
That's good. Okay, the next question comes from Tino Millie.
Tino Millie.
Right. What can I do to minimize nasolabial folds?
What can I do to minimize nasolabial folds? Great question. Let's begin by defining what the hell is a nasolabial fold. As the name says, naso, nose, labial, lip, fold. The fold that goes from the corner of your nose to the corner of your mouth. As everyone's now, I just give them a pause so people can start looking at their faces in the mirror. So the nasolabial fold is the first area on the body that we started filling when fillers were approved. Because we thought, because we didn't know anything, that if there's a fold, it must be filled. You get it? If there's a fold, we must fill it. And so naturally there's this fold there and we go ahead and fill it and it looks better, right? Wrong. So it turns out, at least in my opinion, nasolabial folds, when they're filled, 9 out of 10 times look awful because a nasolabial fold is a normal crease in even young people. I have an 8-month-old. When he smiles, what do you think he has? He has a nasolabial fold. What happens is that as we get older, our cheeks, our midface, the area that's underneath our eye starts to hollow. And as the area underneath our eye starts to hollow, the tissue starts to avalanche into the nasolabial fold, making your nasolabial fold seem deeper than it used to be 10 years ago. So when you go to an average practitioner who doesn't know shit from Cheyenne and they went to some weekend course, they're like, ooh, a nail, let me hammer it. But the reality is the answer is you should fill in the midface or the cheek, therefore, creating more youthful fullness of your your zygoma. It fills in the hollow under your eye. And by the nature of filling your midface, it kind of lifts your nasolabial fold back to where it began. So the long and short of it is I seldom ever fill the nasolabial fold because it always makes you look a little odd. God, good thing for my short-winded answers.
Okay. So the next one comes from I don't know how to pronounce this, GISELLESORI.
No idea.
Giselsori.
All right, great. What's the question?
Lip lift. When is it needed? Is 28 too young?
Lip lifts. I've done segments on lip lifts, and you can listen to those sections. And I really go into a large elaboration. Every so often, there are trends, right? The BBL trend, the breast aug trend. Plastic surgery is always trendy, and then there are trends within the trendiness. And so certain things just like boom, and everyone's doing them. So lip filler. So lip lifts, where you cut under the nose, remove skin, shorten the distance between the bottom of your nose and your lip, thereby which raising your lip, aka a lip lift, is a very, very popular surgery today and super powerful, and anything powerful is super dangerous. Because when you remove that skin, it's permanent. So why do people do it? They do it because they want to make their lips look fuller without having to use filler. So the surgery is amazing when it's done in the person who has a long upper lip. So when you get older and older and older, your upper lip distance gets longer and longer, and your lip slowly disappears into your mouth. And then when you do a facelift, this is a lip lift, is a facelift of the lip. When you remove that skin, it re-lifts your lip. Awesome. When you're 28, 9 out of 10, 9.5 out of 10 28-year-olds have a normal distance. And then they go get a lip lift, and then they look like they had a cleft lip and their lip is attached to their nose. And then, oh my God, but that looks so good on Instagram. Great. I'm glad you live in an alternative universe. Like, you don't live in the meta universe. Like, you have to say hi to people when you see them. So that's the damn problem. It's like people are living their lives for photographs. I know, but it photographs so well. Okay, great. Go on photograph dates. I mean, I don't know what to tell you. So I don't know. It's seldom a 28-year-old, in my opinion, needs a lip lift. If you just genetically have a long distance, maybe. I don't go by age, but I go by distance, and it's way aggressively done. So just like BBLs, a little fat in a flat-butted person is great. You stick in thousands of cc's and it looks ridiculous. So same.
So it doesn't, if they perform a poor lip lift, there's no correction for that, is what you're saying?
No, you own it. The skin's in the trash can and it's stuck here. Your lip's like this. Right? Now you can't be, there's no undoing it.
Yeah.
No, it's way overdone. But that's what plastic surgery is. Trends.
Okay, the next one is from Yanamar88.
Yanamar88.
Talk about awake facelifts, please.
Awake facelifts. So faces, unlike other areas in the body, is unique in that you could, if you wanted to, you could put local anesthesia in the face and you would not feel your face for a period of time. Therefore, you can do a lot of awake surgery on the face. You can do eyelids, you can do facelifts, you can do brow lifts, you can do all kinds of things. The question is not can you, the question is do you want to? So anesthesia, aka wow, I don't feel this, varies from awake, where you have no sedation, just local anesthesia. You're as awake as you can be, you just don't feel anything. Then the next level is conscious sedation, which is they give you some twilight sleep. You're sort of like, like you would do if you're having a colonoscopy. And then there's very deep sedation where we put a tube in and breathe on your behalf. So those are varieties. I, as a surgeon, only do general anesthesia. And the question you may ask is why? And the answer is because I feel like that is the safest and by far the most convenient for me and the patient. The patient's asleep. and comfortable. I am comfortable, and the patient is not moving around and giving me a hard time. And if 1 in 100 something goes terribly wrong, I have control. Now you're awake and you're talking and you're bleeding, or you're moving and you're uncomfortable. I don't want to have to deal with all that crap. So the only reason people do it is because in the general world, the world outside of plastic surgery, there is this massive, massive fear of general anesthesia. I cannot tell you the number of people that are crying before surgery. And I ask them, what's the matter? I'm scared. What are you scared about? You think you're going to have a bad outcome? No, I trust you implicitly. I just don't want to die. Die? What are you talking about? Oh, anesthesia. Why the hell would you die? The risk of dying is less than you drove here, didn't you? You're like 1 in 10 to die in a car accident. Like that's not. So I think people want to do local anesthesia, not because it's so awesome. It's because they're afraid of anesthesia. But the reality is that's just urban legend. Anesthetic today is so safe. So yeah, that's what local anesthesia on the facelift is.
And if they have a problem with anesthesia, you would know in advance before even go. I mean, right?
You're not going to have a problem with anesthesia.
No, I'm saying, could they be like allergic to anesthesia or something, or?
The likelihood of you being allergic to anesthesia is 1 in like 300,000.
Okay.
You're more likely to get shot driving by or hit by a, I don't know, airplane part. These are statistically very unlikely. Can you? Sure. Most people who are allergic to anesthesia, there's no such thing as allergic to anesthesia. You're allergic.
You get a reaction to anesthesia.
You're allergic or have a reaction to a type of anesthesia. Anesthesia is a general term. It's like there's 1,000 anesthesias, anesthetics. Right. What it is you often have a family history. My mom had it or my dad had it. So at any rate, it's very rare, and I think it's way over concerned.
Okay, we have the next question. I think it's from a Dr. Angela Davis. As I get older,
Dr. Angela Davis. Okay.
Yeah. As I get older, I turn 50. It says here, I feel like my nose is getting wider. Can surgery help?
Yes, of course, but then again, no. So what does that mean? So it depends on what's causing your nose to get wider. The reason why one's nose gets wider is the same reason why someone's neck gets shorter. It's the same reason why someone's eyelids get lower. We're changing. We're expanding. Our skin is getting longer. Our skin is getting stretchier. Our nose does tend to get ptotic, droop. Your face droops. Why wouldn't your nose droop? And you'll see that if you look at a gentleman, an older man, typically in your mind, you're thinking of kind of a long, large nose. And you look at his pictures when he was 17, he didn't look like that. Well, his nose changed, just like his ears changed, just like his lips changed. So if the reason your nose is wider is because, you know, your cartilage has thickened and widened, or other reasons, yeah, you can get a rhinoplasty and it can improve. If the reason your nose is wider is because your skin has gotten thicker, we can't change skin. So it depends on if it's cartilaginous, meaning from the structure inside, which can be manipulated, or from the outside and your skin has just got thicker, in which case there's not much you can do.
Okay, this one is from Yessi Campos 26.
Yessi Campos 26. Okay, what's your guess?
Does the tip of your nose stay hard after rhinoplasty?
So when you do a rhinoplasty, you open up the nose, you change the inside, you put the skin back, and then you sit around and wait 12 to 18 months. Mm-hmm. What are you doing for 12 to 18 months? Nothing. You're waiting for the swelling to go away. And the nose, unlike the breast and the ears and the belly and the eyelids, traps swelling much longer than any other part. And you just have to be super patient, and the nose is swollen. When things are swollen, they're stiff and hard and numb. And so at the beginning, your nose will be stiff, hard, and numb. And over the course of 12 to 18 months, it softens. The sensation comes back and it becomes more mobile. So your nose should soften over time. You know, you're not going to meet someone who had a rhinoplasty like 18 years ago and it's like a rock. That's just not normal.
So it depends on the person, how long it.
No, but I mean, it's going to. It's 12 to 18 months. Thin skin quicker, thicker skin later. Eventually, the swelling is going to go away, and eventually it will soften.
Okay. From Miss Vasquez 1109. How painful is rhinoplasty on a scale of 1 to 10? And what is the price range?
So I tell patients So listen carefully. When you look at post-op photos of rhinoplasty, you think, oh my God, what the hell? It looks like they got into a car accident. And you know from bumping your nose on anything, it's horribly painful. Therefore, rhinoplasty must be unbearable. It's not. It is by far one of the least painful procedures we do. Let me say that again. Least painful procedures we do. So much so that 90% of patients don't even take narcotics. Your ear pinning is more painful than your nose job. So the fact that it looks painful and the fact that when you bump your nose, it's painful doesn't correlate to the rhinoplasty. So it actually is very minor. It would be like a 2 or 3 out of 10. A C-section is more like a 7 out of 10, to put it in perspective. You break your arm falling out of a tree, it's a 9 out of 10. So it's quite minor. Price ranges varies. You can never ask a price range. Let me explain to you why. Price range varies on location, surgeon, type of surgery. There's almost 100 variables that go into price. So price can be $1 or $100 million. So price is irrelevant in that you cannot gauge it. You have to find surgeons you like, find out what they charge, and then see if whatever they charge is worth it to you.
That's just the way city where you're doing it, right?
Listen, I mean,
doing it in Los Angeles, like doing it in.
Of course, listen. The price of gas in Beverly Hills is $8 a gallon. The price of gas in Montebello might be $5.75. Again, this is when gas is super expensive. My point being is it may be 30% more expensive in Beverly Hills to get gas. Well, then that means the rent is 30% more expensive. That means the staff that work. So obviously things are going to vary based on location, but then skill set. I mean, some guy graduated last week. Some guy's been in practice 20 years. Some guys' work is garbage. Some guys' work is like, oh my God, this guy's like unbelievable. So price, you cannot compare apples to apples. There's no such thing.
Got it. The next one is from Regina_Okimedi. Why is ethnic rhinoplasty so difficult? I'm scared of doing it because it'll come out worse.
So the question is, what makes ethnic rhinoplasty so difficult? So let's start out with why we even call it that. Some of the things we do in plastic surgery is marketing. People love to label things because when we label them, patients like to hear that, and then it becomes marketing, and then it's easy to advertise. So ethnic rhinoplasty, by definition, means rhinoplasty in an ethnic person. Who the hell is ethnic? We're all ethnic. Basically, anyone who's not Anglo-Saxon from like France or Ireland or England is what? If you're Somalian, are you ethnic? Yeah. If you're from Ecuador, are you ethnic? Yeah. Are you from Saudi? Yes. So pretty much, I would say 80% of the world is ethnic. So that goes there. What it really means is people with thick skin. Thick, oily, sebaceous skin. The reason being is, as I've said many, many times, the way you do a rhinoplasty, it does not matter who your surgeon is or where they are or what they're doing. Basics. The skin comes off the nose. There is cartilage and there is bone. You rearrange the cartilage, you rearrange the bone, and you make a beautiful, beautiful nose. Wow, I love it. Then you put the skin carpet back over that structure, and then you sit there and wait. And you're waiting for the swelling that has occurred between the skin and those structures to go away. So the skin shrink wraps over the new structure, and voila, there's your new nose. When you have thin skin, the swelling is less. The speed in which the swelling goes away is fast. And the structures that you see when it's all gone are much greater. Imagine having a marble on the ground and putting a tissue paper over it. You will see the marble. Conversely, you have thick, oily, sebaceous skin. Who are those people? I don't know. African Americans, Latinos, Asians. It doesn't matter. You could be from North Dakota. As long as your skin is thick, oily, and sebaceous, when you lift up the skin, do all the work, put the skin back, wait for the swelling goes away. Number one, your swelling is more. Number two, it takes forever and a day for the swelling to go away. And when it's all said and done, you see less detail. You're a bit underwhelmed. Oh my God, my nose was so wide and big and flat before. It's better, but it's not fantastic. Yeah, because instead of putting a tissue paper over the marble, I put a huge piece of leather over the marble, or a binder over it. You can't see it. So your skin gobbles up the detail and the skin can't be changed. And that is the basic fundamental difference between ethnic and non-ethnic, in my opinion.
Got it. Well, I think we need to go on a break. And when we come back, we're going to have more questions regarding tummy tucks and other body parts.
No, I'm not coming back. I'm out of here. All right, fine. I'll come back. All right, guys, let's take a quick break. We'll be back for the second half of your Q&A session. We're shifting from the face to the body. Make sure to stay tuned for the second half of Plastic Surgery Uncensored. Welcome back to Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and we're going to continue with our Q&As with me and Maria, the producer. And we're shifting from facial Q&As, facial questions, to more body-related questions. All right, Maria, what you got?
Okay, the first question comes from Maricela Mendoza.
Maricela Mendoza.
Right. Have you done an upper tummy tuck? And I also have another question similar from Genciali. What do you think of a reverse tummy tuck?
So two people asked essentially the same question, so we put them together. So the question is, a reverse tummy tuck or an upper tummy tuck are both the same things, and they're both horrifically terrible, bad ideas. So what does that mean? A tummy tuck is a surgery whereby which we remove extra skin from your belly and normally repair muscles. In order to do that, you need an incision. That incision is in your groin, down low where you would wear your underwear. Now, some patients, the majority of their loose skin happens to be from their belly button towards their breast. In other words, from their belly button down towards their pubis, they have no extra skin. So in their mind, they're like, it's right here. You just pull the skin right under the breast, right in that fold, and take out the extra skin. Why the hell do you want to go from all the way up here, go all the way down there? And the answer is as follows. Number one, from an engineering standpoint, it's flawed. Anytime you take something heavy and you pull it up and you sew it to something, it comes back down. So a thigh lift is the same thing. And so you sew this extra skin underneath the breast, and then magically, not too long after, that whole thing that you sew down gets pulled down. That's problem number one. But that's not really the main problem. The main problem is, what the hell are you going to do with the extra skin between the breasts? So the idea is the incision of an upper tummy tuck is from under each breast. Awesome. But it's continuous. It's a whole line. So the skin moves up, 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 and collects under the breast and between the breasts. So under the breast is easy. You cut out the skin. Let's say it works, which it doesn't. But let's say it does. What are you going to do with the skin that's collected in between the breasts? You have to cut it out. So now you have a line that goes right across the two breasts, like a chevron. Well, that ain't going to work. So obviously, it's a shitty surgery. So don't do it.
Yeah, it's much more noticeable too.
Yeah,
Okay.
It's just a terrible idea.
Okay. But who comes up with these ideas? Other doctors?
Doctors, patients. I've had 100 patients ask me if I can do a tummy tuck through the belly button. The whole thing. Just suck it all into the belly button. Oh
my God. Okay. Lizzie, the next question comes from Lizzie_IG.
Lizzie underscore IG. Fire away.
Have you heard of a drainless tummy tuck? What are your thoughts on that?
Yeah. Have I heard of a drainless tummy tuck?
Mm-hmm.
Also known as progressive tension sutures, also known as quilting. So here is something interesting, because 9 out of 10 times when something new comes up, it's stupid and it ends up not working and it's mostly gimmicky. But this was actually a pretty good idea. So essentially what happens is you lift up the stomach, you do the tummy tuck, and then you take the extra skin down, you sew the muscle together, and then you pull the skin down and you sew it. But then there's this huge cavity, that's the whole area where you did the surgery, and you have to wait for that area to heal and stick back together. So traditionally you left drains, which I always have and actually continue to do. Having said that, there was this idea where you could then actually take the tummy tuck above the skin and sew it back down to the abdomen and seal it closed rather than waiting for it to seal. And so that's also pretty cool because you're obliterating the space that's there, not allowing actually fluid to build up. So it turns out that I do a hybrid. I do quilting progressive tension sutures, aka closing the abdomen down in the midline, down the middle. And then I leave drains on the side because the truth of the matter is that the idea with drainless surgery is that you don't need any drains. Well, what the hell do you need drains for anyways? Fluid. You're building fluid. Fluid. And what happens to that fluid if you don't drain it? It accumulates. Your body's going to make it, so it's going to go somewhere. Yes, some of it you will absorb, but if it's a lot, you won't absorb it. So I don't like to leave that fluid in because I believe that fluid still builds. And so I do a hybrid. So drains plus this sort of quilting, progressive quilting, or whatever. What did she call it?
She called it drainless.
Well, it's drainless in that they're sewing it closed. So it's called progressive tension or quilting sutures. Yes.
Okay. Next one comes from Galu Saran.
Galu Saran, what's the question?
Is a mini mommy tuck an actual procedure?
So I told you to throw this out, but you said keep it in anyway. So a mini mommy tuck doesn't even make sense. This is the problem I have with plastic surgery. Everyone mixes all these terms up. Mini tuck, mommy, makeover, this, that. These are a lot of nonsensical words. So a mommy makeover, that's the word. Mommy makeover is a surgery that is reversing the effects of childbirth in a mother. That is not a surgery. That is a constellation or a combination of surgeries. There is no surgery, mommy makeover surgery. That's a term we give to a bunch of surgeries that you do in a mother because a mother doesn't look the way a mother did before. That could be a labioplasty, that could be liposuction, that could be tummy tuck, I don't know. So do not add the word mommy to anything. That's an adjective descriptive that we use to sell you on surgery. The term mini refers to is something short or long. So the question I'm assuming is a mini tummy tuck, which you remove the extra skin, mini meaning shorter, a real procedure. And the answer is yes. Some people, very small percentage of people, are candidates for a shorter incision because they have less skin than everybody else. The average woman who's had 2 or 3 or 4 kids needs a regular tummy tuck, longer incision, move the belly button, blah, 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 blah. So yes, a mini tummy tuck is a real procedure. A mini mommy tuck thing doesn't exist.
Okay, got it. The next question comes from Sabasari. Sabasari, what do you think of breast augmentation through fat transfer? Which we
I've answered this probably 150 times, but since
you're going to continue to answer.
I guess I'll keep answering it. So as I said to you before, some things are trends, and fat transfer is something that I don't know that it's a trend, but it's definitely something that we're doing way more of than we ever did before.
Mm-hmm.
I mean, I guess principally I like it. I just think it's way overdone, and I think that people are not understanding the basic principles. So the idea, again, here we go. One of the key components in beauty is volume. Volume. I need volume in my breasts for them to look pretty. A flat A cup that's sagging is not pretty. You don't need to be huge. You don't need a triple D, but you need to be a B cup or C cup. You need volume. A flat butt is not attractive. It needs volume. A flat face is not attractive. It needs volume. Small lips that are pencil thin are not attractive. They need volume. So volume is one of the key components to youth. So in plastic surgery, historically, we replaced volume sometimes with an implant, sometimes with filler. And in the last decade, we've done a lot of it with fat. So fat is we borrow fat from some area and we inject it in some other area. In and of itself, as I've said thousands of times, principally, it's awesome. It's a win-win. You borrow fat from areas you don't want it, and you stick it in places you want it. In this instance, she's referring to her breast. What's the problem? That's fantastic. The problem is that in order to replace fat in your face, you don't need much fat. In order to replace fat in your breasts or your butt, you need a lot of fat. Just a big area. And in order to get that fat, you got to borrow a lot of it from other areas. And those areas is the reason why I don't like these procedures. When you borrow it from your love handles and your back and your inner thighs and your arm and your shoulder and all these areas, and you're so excited about it, talk to me in 2 years. Those areas look like shit. They're loose, they're irregular, they're rippling, they got a dent. Go online, ask people. Do not look at photos online. Everyone looks spectacular at 6 months. Because why? Because A, the area you transferred the fat is full because it hasn't died off yet. B, the area you borrowed is still tight because the skin hasn't gotten loose yet. So at 6 months, these photos look spectacular. Talk to these people at 2 years. Number one, the area you borrowed is starting to look like shit. And number two, a lot of the fat that you transferred is gone. So it's not my favorite procedure. There are doctors who think it's amazing. Good for them. Awesome. I'm just not a huge fan.
Okay. The next and final question is from
the final question.
my realtor, Heidi.
My realtor, Heidi. Wow. A plug for real estate. Okay. Gotcha.
Is there any way to do a tummy tuck cut with laser now or in the near future?
So the only reason I did not throw this out is because I've heard this 5 million times. So I just want to put this to rest. This cut with laser nonsense, again, it drives me bananas, is some gimmick that people are using. Listen, you cut the skin with a blade, you cauterize it, you can use a laser. I don't know what that means. All I know is at the end of the day, it doesn't make any damn difference. What matters is if you're very delicate with the skin, when you open it and you don't burn it and you don't traumatize it and you don't squeeze it, and then you put it back together really delicately, it heals better than when you treat skin like cowhide. So I don't even know what this laser business is. A lot of surgeons advertise that they're doing shit with lasers I don't even know what that means.
I think she's saying it because she said, I had natural birth. I guess she's saying she didn't have a C-section, so she doesn't have a scar to begin with. And I think, you always mention it.
What's the question? I'm not understanding. I thought she's asking if you can do surgery with a laser.
But she says that she had natural childbirth.
No, but you can't do any surgery with
she didn't have a C-section. She had natural. So
it doesn't matter if you had a C-section or not. It doesn't matter if you have a scar there. It doesn't matter. You cannot cut someone open with a laser.
No, but I think that's where her question is coming from, because she doesn't have a scar now and doesn't want. Whereas a woman that
I don't want wrinkles. I don't want my hair to fall out. I don't know what to tell you. There is no way to have surgery without a scar. I've said this over and over again. There is no such thing as scarless surgery. There is no such thing. There is the difference between shitty scar surgery and wow, great scar surgery. Some scars are hideous, thick, ugly, nasty, and some scars are thin, flat, narrow, and beautiful. And at the end of the day, you're hoping to get a really, really good scar and not a shitty scar. But anyone who tells you they're going to do anything for you without a scar, run the other direction. All right.
That's it.
And that wraps up another fantastic episode of Plastic Surgery Uncensored. I hope you enjoyed this session of Q&As. As you know, we always rely on you guys for input. I'm not doing this for myself. I'm doing this for you guys. So please, every so often we do a Q&A session, or we actually ask you guys what questions you guys have, and so that we can answer them on our Instagram, which is at Dr. Rady Rahban, at DrRadyRahban. So hopefully you follow us, and that way you can ask your questions, because if you're wondering, where can I ask my questions? That's where we're getting it. At any rate, thank you all for joining us. Hope you enjoyed the session. As always, share this with your friends and family. And if you leave a little jingle on our reviews, we'd love it. We always are interested in knowing your input. If it's negative, please don't leave it. All right. Until next time. Maria, come on. You got to throw in a little joke. Until next time, I'm your host, Dr. Rady Rahban. We'll see you next week.
Thank you for listening to Plastic Surgery Uncensored with Dr. Rady Rahban. We would love your feedback. If you enjoyed this episode, or if you find our podcast helpful, tell us why. Leave us a review and make sure you subscribe on your favorite podcast platform. If you have a topic you would like for us to discuss in an upcoming episode, please reach out to us on Instagram at Dr. Rady Rahban, on Facebook at Rady Rahban or at RadyRahban.com.